I am here today with Dr. Dylan Gold, a clinical psychologist specializing in the treatment of children and adolescents with ADHD. And she is going to talk to us today about how parents and caregivers can give more effective instructions to their children with ADHD.
Yes, it's always amazing when I talk to families about this, because oftentimes, we go through how to make these instructions more effective, and it's sort of like, yeah. And then they go home and they're like, wow, that really does help. So let's talk through a few. So we want to make sure that when we give an instruction, we are telling a child, we're giving a direct instruction. So we're telling them what to do rather than asking it or suggesting it. So things like, oh, would you mind sitting down at the dinner table? Right? We want to say, please sit down at the dinner table. That's a direct way of letting them know exactly what we want to expect. It sounds like semantics, but especially for younger kids, we think in our adult brains, it's more polite sometimes to request by asking. But for younger kids especially, we really want to be direct. So we want to be direct in what we're telling kids to do. We want to be really specific in what we're telling kids to do. So for example, if a child is kind of having some trouble regulating behavior, jumping around on the couch, hey, be good, knock it off, stop that, right? Behave. What does that mean? Does that mean you want me to sit down? Does it mean you want me to lower my voice? Does it mean you want me to walk over there and come to you? So we want to be really specific. Please step down from the couch. Please come sit down in this chair, right? That might be incompatible with what they're doing, which would be a great instruction to give. So we want to be really, really specific. Also, I kind of alluded to, we want to be positive in what and how we frame what we're instructing a child to do. So for example, rather than saying, hey, stop touching that, don't touch that, you might instead give an instruction, please put your hands in your lap. Or please come over here, maybe where whatever that thing they were touching is not, right? So telling kids what to do is particularly important for kids with ADHD, because oftentimes that impulsivity leads them to maybe kind of do the exact thing they were just told not to do. And so that can be really helpful as well. And also it gives them some guidance, right? Rather than just like the absence of behavior. The other thing is that we tend to string instructions one after the next, after the next. All right, so now you're going to go get dressed. And then after that, don't forget to put your shoes on, because then we're going outside and, oh, it's raining. So then go grab your umbrella, right? Oh my gosh, I'm already dizzy hearing that. So what we want to make sure is that we're giving kids instructions one by one. Oh my gosh, please put your socks on. Thanks so much for getting those socks on. Now we're going to do the next thing. It's raining outside. Please put on your rain boots, right? If we give too much and kids are overloaded, that's not really going to help anybody. So we want to do things one at a time. We also want to make sure we're in close proximity. If we're screaming from downstairs and a child is upstairs, they don't see our face, they don't see our eye contact, they don't really hear us, they don't really quite know we mean business, or that there's really something going on that needs to happen. So you want to give those instructions in very close proximity as well. So those are just a few tips for helping to make instructions more effective. And then the last golden rule, and this is the one that surprises everybody, particularly in kids with ADHD, but for all kids, give an instruction one at a time. And when you are done with giving that instruction, wait 5 seconds. And I don't mean count out loud. Don't count out loud, because then that teaches your child that they have till you're done counting to listen. But like 1 Mississippi, 2 Mississippi, all in your mind. Oftentimes what we realize is that kids need a second to process, and they actually more often do it than maybe you're used to, because we're all trained to sort of like give a million different instructions one after the next, because it's like, well, I'm going to have to ask 20 times anyway, so I might as well get the first 15 out really quick. But if we take a pause and kind of hold ourselves back from repeating ourselves and give that 5-second beat, oftentimes kids can process it, and then they could do the very thing we've asked them to do. So that's a golden rule.
Dr. Gold, can you help us understand the gold standard for treatment, for evidence-based treatment for ADHD, and what is behavior training?
Yeah. So the gold standard of treatment for ADHD is a combination of behavior therapy and medication, stimulant medication specifically. We had a big old study back in the 90s that helped elucidate this concept. We also know that behavior therapy and medication therapy, each on their own, are equally effective. Many families choose to start with behavior therapy or prefer to emphasize behavior therapy, particularly in kids who are showing more mild symptoms. So I'll often meet with families that choose to start that way. But I also often have discussions with families if we're feeling like there's a little bit further to go in terms of how the child is really functioning or their ability to kind of receive the strategies. Can sometimes be more difficult if the ADHD is more significant. And that's where we might want to have a conversation about talking to a prescriber. So that's the gold standard of ADHD care. And then the next question you asked was, what is behavior management training? Or oftentimes you'll see it called parent management training. And it is essentially a type of therapy that uses the principles of learning, so things like positive reinforcement, in order to teach new behavior and to change behavior. And what we're really talking about here, particularly for young children with ADHD, is that caregivers, so parents, teachers, they're the star of the show. They're meeting with me, and anybody else who does behavior management training is meeting with the caregiver, the parent, and really talking through how to implement these strategies that will help their child learn in their real environment. It's not just about coming into my office and helping this child be really kind of well behaved in my office or listening in my office or, using good manners. It's about doing that out in the real world. And so we teach parents and caregivers those therapeutic techniques so that they are boots to the ground out in the world with those strategies in their tool belt, and it can take those skills anywhere.